Hi guys, this is Mubin. How are you? So we are covering the immunology questions. Today we will cover the question number 5. Again, these are those topics which I've covered in the YouTube already. So go back and listen to the YouTube lectures. These questions are from the topics covered in these. So today's question number 5 is this. Let's say you receive a patient from a country, country X. The patient complains of weight loss, night sweats, and low-grade temperature, persistent temperature or the low-grade temperature. The question, he has been smoking, he has persistent cough, so you suspect that there is something wrong. I don't want to reveal what is wrong, so you ask for the lung biopsy. The biopsy results come back, and what you see is caseating granulomas on in the pathology. So the question is, what factor causes this caseating granulomas or caseous granulomas? What immune function occurs which finally causes this formation? So here are some choices. So let's say the choice is interleukin 12 causes that, or interleukin 4 causes it, interleukin 5 causes it, C3a causes it, interferon gamma causes that. So these are various options. Out of those options, which option contributes to formation of the caseous granulomas or caseous granulomas? So let's very quickly see this. Of course, from the symptoms you can figure out that this patient has tuberculosis. So persistent cough, low-grade fever, night sweats, weight loss are examples or symptoms of the tuberculosis. So of course the patient is suffering from mycobacterium tuberculosis. You got the biopsy. Biopsy is showing the pathology which is indicative of the mycobacterium tuberculosis and the body's reaction to it. So the question is, how does that reaction take place? So the first thing to understand is that the mycobacterium tuberculosis is an intracellular pathogen, and usually it is the macrophages which combat that and which fight it. So now remember, in our previous lectures, again the point of these questions is that we are handling those questions which have been covered. So in our lectures we have discussed this, that when a pathogen like mycobacterium tuberculosis comes into the body, so let's say here is that pathogen, the antigen presenting cells pick up the pathogen, they engulf it, they break it apart, and then they present it as antigen on the surface. Plus, so this is the innate part. Plus what happens is that interleukin 12 is secreted. This interleukin 12 causes the naive T cells to become activated, right? So they become active T cells or T helper 1 cells. T helper 1 cell. Remember, naive T cells are called T helper 0 cells. So they become T helper 1. Now please remember this. This is that interleukin 12 interferon gamma axis. Helper T cells in return release interferon gamma. This interferon gamma in turn acts on the macrophages, and this cell, antigen presenting cell, could or could not be macrophage. This could be other APCs or this could be macrophage. So let's say in our example this is a macrophage. So interferon gamma in turn causes the activation of the macrophage. Now what does the activation of the macrophage mean? What does interferon gamma do? So what it does is this. So 2-3 very important things. One, interferon gamma causes the phagolysosome formations. What that means is that within so I'm going to go here. So let's say this is a macrophage, and here is a phagosome which has a mycobacterium sitting in it and having fun, and here is a lysosome which has the bactericidal chemical substances in it. What would happen is that as a result of activation, these two would more easily fuse. So that fusion would cause the formation of phagolysosome. Once a phagolysosome is produced, that would of course cause the killing of this pathogen. So that is one way of activating a macrophage. The second way of the activation of the macrophage is that we develop inducible nitric oxide substances, INOs. We also, the macrophage also helps create the free radicals. These are also some things which are dangerous for the cell membranes and for the disruption of the pathogens. Then one other function which interferon gamma does, and this is very important, that the activated macrophage releases tumor necrosis factor. Tumor necrosis factor then attracts the monocytes, the neutrophils, onto this site. These guys, when they come to the site, they become epithelioid histiocytes, and they would start covering the area around the mycobacterium. So this formation with the central caseating part and then the cellular epithelioid cells. Epithelioid cells are nothing but the monocytes which have come there and become flattened and look like epithelial cells, that's all. But what these are essentially, this is a layer of protection which has been formed around the pathogens and the macrophages and those cells which are combating this pathogen. So this layer's job is to isolate and wall off the pathogen and sort of try to kill it. And that central caseation is actually the area where the necrosis is happening. So just remember this thing, that the total axis which you should remember: antigen presenting cell, pathogen's entry into the body, antigen presenting cell picks it up, presents it, plus it secretes interleukin 12. Interleukin 12 converts naive T cells to the active T cell, T helper 1. T helper 1 then converts interferon gamma. I think if I can repeat this 100 times, I will. This is IL-12 interferon gamma axis. What happens is here, what is this side? This is the innate immunity side, right? And what is this side? This is the adaptive immunity side, correct? So innate immunity activated the adaptive immune system. Adaptive immune system in return activated the innate immune system. So that is how they work with each other, and this is what is called the interferon, IL-12 and interferon gamma axis. The result is this then: interferon gamma causes activation of the macrophages. The activated macrophages then in turn, number one, form more phagolysosome, cause the killing of the pathogen, create free radicals, INOs, which also are damaging factors, also creates tumor necrosis factor, which causes the recruitment of the monocytes and neutrophils and other things over here, which cause walling off of the pathogen and forming the granulomas. So thank you very much. So if we actually, sorry, I should not close it yet. So out of these options, IL-12, yes, that can be possible, but that is one step behind. Interferon gamma, that is the most directly relevant answer. Interleukin 4, it has nothing to do with the caseating granulomas and the macrophages. Interleukin 4 normally converts the naive T cell towards T helper 2, which would then cause B cell activation, and that would cause humoral response. So it has nothing to do with this thing. Plus IL-4 also works on the B cells to create the immunoglobulin E, plus the growth of the B cells. IL-5, again, differentiation of the B cell and B cell related functions. C3A, that is a component, it's a split component of C3, which is an anaphylotoxin, a vasodilator. So when this is present, this is really what causes the anaphylotoxic, contributes to that anaphylotoxic shock. And so the most relevant answer is interferon gamma. Thank you very much.